Doctors Johnathon Bird, Victoria Damba, and David Kapp talk about the benefits of hospice for their patients and their families.
As a family physician, I have a key role in the conversation at the end of life with patients and families. Because I'm able to follow these families and these patients over their chronic disease states, I can see where we need to start talking about end-of-life care.
As a physician, when we see patients declining, they're either losing weight or they don't have the energy or, the bright eyes that they've always had. You just know. My role, I feel, is to bring that out in the open and actually talk about it.
I've used hospice services really for as long as they've been around. And I think every single patient has different needs. And I think hospice does an excellent job of being able to meet the patient where they're at, support those needs.
Hospice care can make a huge difference for patients, for families, and actually for me as well. What people don't realize a lot of times is the comprehensive nature of what hospice can do for patients and families. It is involving the family doing everything that the hospice can do to provide quality time with the family for whatever time a patient has left on earth.
As a physician, I just know that my patients are being kept comfortable in a time that is very difficult for them. Again, they have a lot of needs at the end of life, both physically, mentally, spiritually. A lot of them need to prepare somewhat for the end of their life, and really their families need it as much as they do. As a physician, we can't meet all those needs just seeing them on an occasional basis.
When people get to a point in their life where they know they have limited time, I feel that where hospice can really help them out is to keep them in their home where they're comfortable and where they want to be and where their loved ones want them to be.
I like to express to patients that hospice is a wonderful service that you need to take advantage of. I encourage all my patients to at least look into it, listen to it, be informed about it, because there is a lot of misconception too on what hospice is and what that means.
Hospice doesn't mean that you're going to die tomorrow. If you decide to go on hospice and you decide that I don't want to be going back to the hospital, then things are good, but you can change your mind and go off hospice and go down a different road if you want.
I have yet to this day have a patient come back afterwards and tell me they regretted using hospice, even patients that were very hesitant to use it in the first place.
A good hospice company will do everything possible to prolong quality for whatever life we have left.
I've worked with Serenity Hospice Care for a number of years, and I've always been really happy with their nursing care, happy with the feedback I get from the family afterwards.
I like the fact that they're a nonprofit organization and that their primary focus is on the care of the patients. They have a very good team approach.
I closely work with Serenity Hospice Care, and therefore I get to see the care, the compassion, and the teamwork with which Serenity works that I've not seen elsewhere. And if I am ever in such a state that I need to consider hospice, I would request Serenity.